Well, we've established that the best thing for me is a hair transplant. It's not this. Do it again. Well, we've established that the best thing for me is going to be a hair transplant. No, it's not going to be something that's going to happen in my house. So this is where it happens, and it's right here in your offices.
That's right. Our hair transplant facility is an outpatient facility, so this is where you're going to be. This is where the magic's going to happen.
Now, tell me a little bit about this, because I'm a big sissy. And I got to admit, I'm a little bit uneasy about, just seeing that there's going to be any kind of work done. How bad is the pain, and what kind of anesthesia? I mean, am I awake? Am I under? What is that like?
Well, it's a common myth that hair transplants are a painful, torturous procedure, and it's really not the case anymore.
Okay, good.
We've got local anesthetic. It's going to knock the sensation out all over the scalp.
Okay.
Your scalp is going to be completely numb. You're not going to feel anything that we're doing.
Really?
Just a little bit of vibration.
Okay.
You're going to be comfortably seated in the chair. Some parts during the procedure, be watching a movie.
Okay.
Some parts you'll be laying down on your belly or on your side, maybe napping, maybe listening to your iPod, or
Like you could actually sleep through this?
Oh,
procedure?
yeah. There's a lot of the part of the procedure where you're going to be very relaxed and laying down, and a lot of patients do nap.
For me, how long are we talking? Like, how long is this going to take? Because I got a good bit of hair loss.
Well, hair transplants aren't done on the lunch hour anymore.
Right.
Hair transplants are 20-man-hour jobs that are done between 7:30 in the morning until about 4:30 or 5 in the afternoon.
Wow. Okay.
And there's a lot of work that goes on
Sure.
in between that day of surgery.
Okay.
Think about this. We've got to make all the sites for literally thousands of follicles.
Yeah. Okay.
And we've got to harvest.
Right.
We spend 3 to 4 hours harvesting the follicles.
Okay.
And then we've got to spend some time, another couple hours, putting them in.
How much time do I have to ask off of work for? Like, I mean, the day before, is there any prep? What about the day after? I mean, how long am I going to be out?
Well, for you, we're sending you back the next day because we want to show
Really?
how everybody's feeling good and looking good immediately after the procedure.
You could get this done on a Wednesday and be back at work on Thursday.
Well, you could go about your daily routine. And
Okay.
of course, how you look, is going to
Sure.
determine, whether you're going to go back to work or not. The bottom line is that you're going to have some crusting and scabbing
Right.
in the areas where we've done the work.
Okay.
It's going to take about a week for that to resolve, for the scabs to flake, and for everything to heal.
Uh-huh.
But in terms of discomfort, I mean, after the procedure, you saw the photos, it kind of looked like a sunburn in the
Right,
area.
yeah. Mm-hmm.
Kind of feels like a sunburn too. Most patients say that it's a little bit tender to the touch on that second day,
Okay.
and then after that, they're off of all pain medication.
Wow.
Did you know that 90% of all patients don't need any narcotic pain medication at all?
Really?
Yeah. It means a Tylenol or Motrin does the job, and that's it.
Okay, so it's going to be relatively pain-free. I get it done in one day, and I could be back to work basically the next day.
You can be back to work very quickly. It all depends, if you can hide the area or you want to hide the area.
Okay.
That'll take about a week, the cosmetic process for that to resolve.
Not nearly as bad as I thought it was going to be.